If you're listening to this tape, you've requested information from your dentist in regards to Sedation Dentistry. Now, chances are it took some courage to even make the telephone call to request this audio tape. Your dentist understands this. Dr. Tim Modick has been providing dental care in the Mechanicsville area for the past 24 years. Dr. Modick's a 1974 graduate of Case Western Reserve Dental School and has received advanced training in dental residency. Dr. Modick received his initial training in sedation dentistry in 1975 and has used it successfully for over 27 years. He's a member and has a fellowship in the Academy of General Dentistry. He's a member of the American Dental Association, the Maryland Dental Association, and the Dental Organization for Conscious Sedation. Dr. Modick understands your concerns and, well, he's here to help you. This tape begins with an interview of Dr. Tim Modick by Jill Chernikoff, an investigative reporter and anchor person for Fox News.
Hi, I'm Jill Chernikoff, and I'd like to congratulate you on the courage it took to make the call to request this tape. I invite you to listen to the tape with a friend or a companion, someone who understands you and can support you on this important journey. I'm here to help describe for you the amazing benefits of sedation dentistry. Sedation dentistry is absolutely safe and completely comfortable. If you're listening to this tape, you should know that you're not alone. 50% of all Americans won't go to the dentist. Most of them won't go because of a previously bad experience. How long has it been since you've been to a dentist? Would you like to have that beautiful smile you can be proud of? Would you like to be comfortable and out of pain? Would you like to be able to eat anything you want again with total confidence? Or perhaps would you like to accomplish your dental care in as little as one appointment with little or no memory and absolutely no pain? Well, sedation dentistry can help provide all of these things for you. Oral sedation dentistry is so simple. After you meet the doctor and team and decide on the best choice of treatment, you're scheduled for the sedation dentistry visit. Now, this will start by you taking a pill an hour before coming to the office so that you can begin to comfortably rest through your dental care. What could be easier and better than that? Let's hear more about this wonderful way to a beautiful smile from your dentist.
Hi, I'm Dr. Tim Modick, and it's really great to be here with you, Jill.
Welcome, Doctor. What is it like for your patients to even pick up the phone and make that very first call?
The first thing I'd like to say to anyone listening to this tape is that I compliment you on calling our office. I know it probably took a lot of courage. I really want you to know that you're not alone. At least 50% of the population in North America doesn't go to the dentist except for dental emergencies, a broken tooth, or a toothache. And there are countless people who have dental emergencies and still don't go to the dentist. They realize their need for dental care, but don't like the idea of going to the dentist. Wouldn't it be wonderful if we could eliminate these deep concerns? Well, the good news is that now we can, with sedation dentistry. For most people, sedation dentistry is the answer to their dreams. Take a pill and wake up to a beautiful new smile.
Doctor, how long has it been since your average patient has been to the dentist?
Jill, my average sedation patient hasn't been to the dentist for 7 years. And some of them for much, much longer time than that. Many of my patients, when they come in, describe how they cover their mouth with their hands when they laugh or smile. Have you ever seen people do that, Jill?
Oh, absolutely.
Or men who grow long mustaches or beards to cover their embarrassment. But you know, people no longer have to suffer in agony and discomfort thanks to sedation dentistry.
Well, why is it that so many people are so afraid of going to the dentist?
You know, Jill, that is a really wonderful question. People ask me all the time, whose fault is it that so many people are afraid of the dentist? Well, I'll tell you, it's no one's fault. Dentistry many years ago was not as gentle as it is today, and as a result, people have developed a substantial amount of fear based on the reality of their experience. You know, it's this fear that prevents them from having a healthy mouth. Jill, some people listening to this tape are asking themselves, do I have something wrong with me? Do I have a psychological problem? The answer is a resounding no. They're just having a natural response known as the survival instinct. If someone has been hurt in the past, it creates a negative experience. Their psyche or their mind tells them to stay away and avoid the situation that reminds them of this negativity. In our office, we never lecture our patients or put them down for having this natural instinct.
Oh, that's so great.
Now there is a big breakthrough with sedation dentistry. A very high percentage of my patients have had wonderful changes in their lives thanks to this non-judgmental approach to creating a beautiful, healthy smile.
What is it about sedation dentistry that makes the patient's experience so different, Doctor?
Well, one of the major benefits of sedation dentistry, Jill, is that it leaves you with little to no memory of your visit.
You're kidding.
No, our patients' natural response afterwards is that they've had a very good visit and they no longer need to avoid this type of care. Jill, when someone first comes to my office, we sit down with them and we give them a chance to share their experience with us and talk about their individual situation. This way, we can address their concerns about dental care and then treat their needs while they are sedated.
Now, who specifically would be a good candidate for sedation dentistry?
Well, adults who have a lot of fear of the dentist, or maybe just hate the sound and smells of the dental office. With sedation dentistry, our patients don't experience these things. Or perhaps it's the fear of needles. You know, we are all afraid of needles.
Oh, believe me, I know it.
And sedation dentistry is accomplished with just a small pill, no IVs. Some patients have a bad gag reflex, and this is definitely not a problem with sedation, Jill. Also, people who are afraid and embarrassed about their teeth and want their teeth to look nice. They just want a nice smile that looks professional and enhances their image. This all can be accomplished with sedation dentistry.
That sounds wonderful. What is one of the most common concerns that you hear?
One of the biggest concerns is that the patients can't get numb. Now, they may have even heard from a previous dentist, "You can deal with this," or "just a little bit more," or "You're just feeling pressure. You must be numb." If a patient has heard this before, it is just not true, Jill. Many people's teeth are just more sensitive than the average. They need special care to make them completely comfortable. That's the only way I care for my patients.
Great.
If a patient has very sensitive teeth, they won't feel anything while they are sedated. And you know, the second biggest reason that people avoid going to the dentist is because they dread sitting in the dental chair for up to 10 separate appointments. You know, Jill, many times we can accomplish this in just 1 or 2 appointments.
Wow, that's incredible. Tell me about the ability to do dentistry in just 1 appointment.
Well, Jill, here's a typical story. A patient has been avoiding going to the dentist until it was too late, and they had to have a tooth pulled. So then nothing hurts, so they let it go again for a while, and it hurts again, and now they're embarrassed. They visit a dentist who explains that it will take many, many appointments to fix their mouth. So then they get discouraged and they put it off. Well, they don't have to. We can help them accomplish their treatment in as little as 1 appointment. While our patients relax the time away sedated, multiple processes can be accomplished in 1 visit. We help people regain their confidence and replace missing teeth comfortably while they are sedated.
Doctor, is one of the problems that people are afraid of hearing bad news about their mouths?
My patients typically understand the seriousness of their mouth, but they don't want to hear any judgment about it. They have heard it before. "I can't believe you let yourself get into this bad of shape." Or maybe, "My, you really are quite neglectful." Let me say this again because it is so important. In our office, people are respected. We care about their feelings. We are encouraging, and we are never being judgmental.
Okay, explain to me how it all works.
Well, how it works is pretty simple. First, before the sedation appointment, our patients will be given a pill. Yes, just a simple blue pill. They take that pill at home 1 hour before their scheduled appointment. Someone will need to drive them to the office that day, and when they arrive, they will be relaxed and tired.
That sounds too good to be true.
They are then covered with 1 or 2 warm blankets and will sink into a very, very soft pillow-like mattress, especially made to fit into the dental chairs. We will then begin to monitor their vital signs, pulse, blood pressure, and breathing, with our pulse oximeter, a sophisticated medical instrument. We will never start treatment until they are absolutely comfortable and totally relaxed.
That's reassuring.
After that, we'll do the dentistry that is scheduled. Some people can have all their dentistry done in only 1 sedation dentistry appointment. Others do require more. You can see that for busy people, getting all their dentistry done with sedation dentistry really beats 6 to 10 visits over months or even possibly years to have all their dentistry completed. For busy people, sedation dentistry is really fantastic. When their visit is over, we'll sit them up and provide some fruit juice. Most people wake up pretty easily with just some juice because remember, you have not had anything to eat or drink for a long time. Patients will lose track of time. As a matter of fact, most people wake up from a 3 or 4 hour dental procedure and say something like, "Wow, that was really quick."
What is this medication?
The medication is a little blue pill, a sedative hypnotic pill related to Valium. It is short-acting, and your body uses up half of it within 2 hours. It is the same medication that is prescribed millions of times a year by physicians as a very safe prescription sleeping aid. This medication is very, very safe.
Well, what about side effects?
There are 2 predominant side effects. First, Some people get the hiccups, which usually last only a few minutes, and second, their mouth may become dry.
That doesn't sound so bad. Are there any restrictions before the appointment?
Yes, there are just a few restrictions. Our sedation patients won't be allowed to eat or drink anything after 7 p.m. the night before their sedation dentistry appointment. No sedatives or alcohol 24 hours prior to or after their appointment. No stimulants, smoking, or caffeine 12 hours before or after their appointment. And of course, they'll need a responsible person to drive them to the appointment and return to take them back home again after the appointment is over.
Wow, this sounds so fantastic. Let's talk to some of the patients. I'm curious, what was it like for you to make that first call, Gwendolyn?
I was very nervous.
Chris, what was it like for you to make that first call?
It was scary. It was scary. It was calling a dentist's office, so it was scary.
Edna, tell us about making that first call.
My heart was pounding. I think I waited about a day or so before I made the call. But my heart was pounding, and there was a friendly voice on the other end. And the person that answered the phone, by talking with her, she understood my problem, and it caused me to feel more comfortable.
Tell me more about that.
The first evening of the first visit was to do an exam. And that day I was anxious, but I knew I was in good hands because I've heard the testimonies of other patients. And so I knew I was going to be in good hands. I knew that I was going to be with someone who understood the fear of coming to the dentist. And so when I walked in the door, my knees were knocking, but I said, I'm here, and I just feel like I'm going to be well taken care of.
What was that like for you?
After my first appointment, I asked various questions. I felt pretty comfortable, and I wanted to go home and talk everything over with my husband, which I did. I took the tape that was given to me, and I listened to the tape, and I listened to what other people, what they went through.
Chris, what were your dental experiences like prior to sedation dentistry?
My definition would be horrible, absolutely horrible, to the point that I got into total avoidance, anything to avoid the dentist.
What were your dental experiences prior to sedation dentistry?
It was painful, and I'm a very scary and nervous person about having any work done in my mouth, and I was always afraid of needles and things like that, so I was very much afraid.
Tell me more about that.
I was self-conscious. I would always not open my mouth. I wouldn't smile very much because I didn't like the way my tooth looked at the bottom. It was very uncomfortable for me to eat. I couldn't chew on one side of my mouth. It was very uncomfortable. It's a very uncomfortable feeling, and I never got used to not having teeth in my mouth, and I always felt bad even with what I had in my mouth. And I had a very bad tooth at the bottom that I really couldn't chew on that well, so I had to chew on one side of my mouth.
Chris, what were your dental experiences like prior to sedation dentistry?
Dentistry was far from high on my list. And I was only getting one or two things done. And it just turned me off, big time, So there's got to be some other way to get this done. I was really surprised because I already had a filling done, and I was in agony for 2 weeks after I had a filling done. I was always going back. There was something wrong with it all the time and all. I said, I don't want to go through that. I'd rather get them all pulled out.
Edna, what were your dental experiences like prior to sedation dentistry?
Rotten, really rotten. I would duck and dodge people. I had a low self-esteem, but now I'm back to myself.
Tell us what it's like for you now.
Excellent. I tell you, once the pill is working, you come and you're placed in the chair, you don't care. Just do what you have to do. And I felt so calm. I think I was having conversations with you. It was like, do what you got to do. I know I'm in good hands. You feel relaxed, extremely relaxed.
Gwendolyn?
But I felt very good about it. I wasn't afraid. I wasn't nervous. I was very relaxed.
Chris, how do you feel now?
Well, I drive an hour and 15 minutes to come here, so it's not an avoidance.